I'm Megan Hall,
And I'm Annalise Zambito.
and we're from Monacan High School. And for our health career display, we chose a speech-language pathologist, which is someone who works to prevent, diagnose, and treat speech, language, swallowing, social, and cognitive disorders. And they work with adults and kids that may have these disorders.
Some responsibilities of a speech-language pathologist include maintaining fluency with their patients while they're speaking and also improving their speech sounds. As represented in our model, some commonly mispronounced speech sounds are SH, R, S, and CH. They work with both their patients and families on how to cope with difficulties in swallowing and speech. They work with their patients to regain muscles to help them swallow, and they evaluate different levels of swallowing and speech. They create and carry out treatment plans.
Benefits of this career is that they get to have creativity with the treatment plans for all of their different patients. They get to work with a diverse range of patients, like different ages and different disorders that their patients might have. They can specialize in a certain age group or a certain disorder. They get to see their patients grow through their treatment and reach their goals. They get to know that they're having an impact on their patients because they can see their confidence grow. For example, if a kid were to have a stutter, that would have a big impact on their confidence, meaning like they would have low confidence probably. So if they went to a speech language pathologist and worked to improve their stutter, then they would grow in their confidence, and the speech language pathologist would really see that and know that they're having an impact. And finally, there's a variety of settings that you can work in as a speech language pathologist. Some include research, education, and obviously healthcare. You could work in a hospital, a private practice, or a health department, just to name a few.
Some challenges include misunderstandings. Not everyone knows what a speech-language pathologist is and what your role is in treating patients. Specifically in hospital settings, you have to work with doctors to come up with the best treatment plan on to work with speech and swallowing disorders, and people may not understand your role that you play in that process. There may also be a lack of funding, which will not allow you to have resources that you may need to treat patients.
Education for a speech language pathologist: you need to have a master's degree in either speech language pathology or communication sciences and disorders. And while you're getting your degree, you need to do clinical hours with a speech language pathologist. And you also need to pass the Praxis 2 exam, which is an assessment in speech language pathology. And with this exam and obtaining a state licensure, you can work in the state that you want.
Why did we choose this? Personally, for school, we had to pick a mentorship to be able to observe and learn about a health career. I picked speech language pathology, and I have enjoyed observing my mentor work with patients, and I was able to connect with the patients and see them grow throughout each speech session. It is also a growing career. It is projected to grow in the future as a need will increase for speech language pathology. How it fits into the health career field. Specifically in hospitals, you will work with doctors in coming up with the best treatment for patients. This will be in swallowing disorders, and it can also be, for example, in stroke patients. Stroke patients may lose their ability to speak, and as a speech language pathologist, you will help them regain their ability to speak and improve their speech sounds. There are also many other disorders that you will work with and help others cope with in hospital settings and in other health career settings. Salary for a speech language pathologist: the national average is around $77,510. The local salary average is $72,300.
To find information for our project, we use websites like the American Hearing and Speech Association and other reliable sources to find the correct information we needed. And we just took a lot of time researching and putting our information together. Thank you for your time.
Thank you.